Hello, how are you all? Hope you all are fine and preparing well for your AMC Part 1 examination. This is Dr. Zahra, and today we are doing some important lines. We will discuss from John Murtaghs, the most important book for AMC Part 1 examination, and we will discuss the lines which can come in exam as SBA questions. So let's start. This is part 7, Women's Health, page number 1046, cervical cancer screening. So, cervical cancer, it states that it is the fourth most common cause of cancer death in the women worldwide, especially in developing country. The most common cervical cancer is squamous cell carcinoma, accounting for 80% of the cases. So, the most common cervical cancer is squamous cell carcinoma. Adenocarcinoma is less common and more difficult to diagnose because it's a start higher in the cervix. So, the most common cervical cancer is squamous cell carcinoma. Cervical cancer almost exclusively occur in women who have been sexually active due to exposure to human papillomavirus HPV. Other risk factors include smoking, use of combined oral contraception greater than 5 year, immunosuppression, and exposure to diethyl stilbestrol in utero. So these are the some risk factors, but most common cause is HPV, human papilloma virus. It is stated that since the introduction of human papillomavirus vaccine in Australia in 2007, the incidence of low and high grade abnormalities has significantly reduced in vaccinated population, and it is reduction is as high as 45% for low grade and 80% for high grade abnormalities. So already we discussed that it is now well established that the primary cause of cervical cancer is HPV, human papilloma virus. So, HPV 16 and 18 are responsible for around 70% of invasive cervical cancer and 50% of high grade lesion. These are some important points. Cervical cancer is a rare outcome of HPV infection. Most cervical HPV infections are cleared or suppressed by cell mediated immunity within 1 to 2 years of exposure. Persistent infection of the cervix with a high risk HPV is known to cause high grade cervical changes that, if left untreated can progress to cervical cancer. More than 99.7% of cervical cancer test positive for human papilloma virus DNA. So the basic pathology, the focus of attention is the transformation zone. What happening in the transformation zone? The columnar cell lining the endocervical canal undergo metaplasia to squamous cell in the region of squamo-columnar junction. It is important clinically to realize that this transformation zone can extend with progressive metaplasia of columnar epithelium. So the squamo-columnar junction may recede into the endocervical canal, and this is also a feature of postmenopausal women. As a squamous cell carcinoma almost always arise in the transformation zone, it is vital that cells from these areas are sampled. This is very beautiful picture on page number 1047, the transformation zone, and here you can see they have circled the transformation zone. So beautiful picture to clear the concepts. This is also the important and picture. So they have you can see here that the appearance of the cervix in the reproductive age is changed as compared to menopausal, peri, and postmenopausal. So in the menopausal age, the cervix and vagina and the vulva become atrophied. So cervical os also, it is, you can see it's very narrowed. So here is also the changing position of the transformation zone with age. They have clearly showed here. So from the circle area we have to take the sample, and endocervical brush or a spatula usually we are using to take the samples. This table is very important. You can see here that there are the description and with the in one column, sin grade in the second column, and Australian modified system, Bethesda system in the third column. So description is normal. In the first one, you can see normal, and within the normal limit, the sin grade is normal, and within the normal limit. Then second is atypia. Then again the sin grade we can label it as atypia. Then third description is HPV. HPV is in grade and low grade squamous intraepithelial lesion in Australian modified Bethesda system. Then a mild dysplasia. So this is very important, that mild dysplasia we always categorize sin grade as sin 1. This is very important description. So whenever mild dysplasia, sin grade is sin 1, and in according to Australian system we will label as low grade squamous intraepithelial lesion. So mild is sin 1 and low grade. Then coming to the moderate, moderate is sin 2 and is always labeled as high grade squamous intraepithelial lesion. Then severe is sin 3 and high grade. Then carcinoma in situ is also we are labeling as high grade, carcinoma in situ in as a sin grade. And then invasive, invasive and invasive carcinoma. These are the some description and some kinds, some category they have given according to the sin grade and according to their system. So this is very important line to remember, that mild dysplasia sin grade is sin 1, and according to this Australian modified Bethesda system this is low grade. Then sin 2 is high grade, then sin 3 is high grade. So from sin 2 onward we are according to the Australian system, it is category, the category is high grade squamous intraepithelial lesion until invasive carcinoma. So invasive carcinoma we will label as invasive carcinoma. All right. So these there are the clinical presentation. Many patients with cervical cancer are asymptomatic, and when early symptoms do arise, they are often dismissed as of little consequences. Symptoms, if present, may be irregular vaginal bleeding. This is very important, especially postcoital or intermenstrual bleeding. So postcoital or intermenstrual bleeding is usually might be due to a cervical intraepithelial neoplasia or cervical cell changes or carcinoma. So we have to always screen for if it is due, the pap smear or HPV is due, then we have to go for the screening test. And nowadays the screening done with the human papilloma virus testing from the sample. So the symptoms are irregular vaginal bleeding, postmenopausal bleeding, vaginal discharge, and symptoms of advanced disease are back pain, fatigue, and vaginal fistula.